Periodontal disease is really just another word for gum disease. 75% of the US population has some form of it. It can cause a loss of teeth and is linked to a slew of other common diseases in our body. Heart disease, diabetes, preterm labor, autoimmune, inflammatory diseases. So let's go over this for a second, the connection between the health of our mouths and the health of our bodies. Okay, so if a bacterial infection begins in the mouth, begins the inflammatory process, it causes a breakdown of the tissues and thus bleeding. Bleeding in the mouth doesn't just stay in the mouth. It can spread to all those bacteria and toxins into the bloodstream. So now they have access to our entire body. This process can contribute to, and is a huge player, in some very serious life and death situations. I'll go over a couple. Heart attack and stroke. Okay, so once the periodontal bacteria have entered the bloodstream, they have the capability to enter and embed themselves in the arterial walls, and thus start the inflammatory process within the lining of those arteries. Okay? This causes heat, swelling. If the patient has cholesterol sitting on those arterial walls, the heat and swelling can cause that cholesterol to burst and create a hole in the artery. Well, now the body says, wow, we have a hole in our artery, and the immune system kicks in to form a blood clot, basically a scab to cover the hole. If that scab is big enough to block the blood flow, the patient, you potentially could have a heart attack. If it gets carried away and winds up getting caught in that heart, that's the actual heart attack that happens. If it travels to the brain, it can cause a stroke. So now let's talk about the consequences of diabetes. So diabetics are prone to develop gingivitis and periodontitis for a few reasons. They have lowered resistance to infection. As we know, if you're diabetic, you know that. You have slowed healing. You have dry mouth as a consequence. Excessive blood sugar increases glucose in the saliva and blood and encourages growth of bacterial plaque in the mouth. So periodontal disease can exacerbate diabetes because it is a chronic infection. The body releases glucose to fight the infection, which elevates the glucose level and also spreads inflammation into the body. So what happens first? Does perio exacerbate diabetes or diabetes exacerbate periodontal disease? Well, unfortunately, it's a negative synergistic effect. So let's talk about pregnancy for a little bit. Pregnancy. Increased hormone levels create an overreaction to susceptible bacteria. Okay? Periodontal disease has been shown to contribute to preterm, low-weight babies, and in some cases, fetal death. Bleeding in our mouth doesn't just stay there. It spreads periodontal bacteria into the bloodstream. A spirochete, which is a type of bacteria, can actually bore itself into the lining of the uterus and enter the amniotic sac, leaving a hole for other bacteria to enter, contributing to the infection for a baby. Inflammation that spreads to the body spreads something called prostaglandins, which are hormones. They can induce premature labor, which also contributes to preeclampsia. It's super recommended to eliminate infection and frequent recall during the pregnancy for the health of the baby. Lastly, let's talk about arthritis for a second. Arthritis is very similar to perio in that both are chronic inflammatory diseases. They occur in the soft tissue near the bone, and if left untreated, can cause bone destruction. Periodontal pathogens have been found in the synovial joint fluid, and some bacteria have been actually shown to cause the anti-inflammatory reactions within the joints, initiating arthritis. So it's imperative for patients with rheumatoid arthritis to be periodontal disease free.